Welcome to the Ty Beal Show, where we discuss food, science, and life. I'm Ty Beal, a scientist at the Global Alliance for Improved Nutrition, or GAIN. My guest today is Dr. Jaffee, a medical doctor specializing in psychiatry, a mental health advocate, and co-founder of NutriTank. Dr. Jaffee has won numerous awards, including the 2024 Cura Mental Health Advocate of the Year Award, and has been recognized in the official NHS 75th Anniversary book. She's passionate about preventative healthcare, nutritional psychiatry, and youth mental health advocacy. In our conversation, we explore the fascinating connections between food and mental health. A quick note before we start. This podcast is separate from my role at GAIN. All right, let's dive in. Ali, welcome to the show.
Thank you so much, Ty. Great to be here.
So you wear many hats. You're a psychiatry resident doctor, social entrepreneur, content creator, charity trustee. So what drew you specifically to psychiatry in this area?
So I think with many people who enter the field of mental health, there's been a story that's either happened to them personally or within their social network. And for me, that story started when I was 2 weeks old and I lost my maternal grandfather to suicide. And he was a physician in South Africa. And aged 2 weeks old, I went on a plane with my parents and we traveled to South Africa where my parents attended his funeral. And I later found out in my early adolescence the cause of his death when I was doing a family tree project, and my mom felt able to tell me about the cause of his death, although originally I'd been told something else, as I'm sure is pretty common with families when you're dealing with stigma and also just consciousness about how do you tell a young person about suicide and educate them on that. And a penny just dropped in my world for me, and I had a huge fascination with the complexities of the mind, the vulnerability, and how someone could get to that stage where they felt that life wasn't worth living. And so I immediately thought, well, what profession does that align to? And discovered the world of psychiatry, and then realized to become a psychiatrist, you need to go to medical school. So I actually chose the path very early on. And during medical school, I did try, although I am pretty stubborn, I'm a Capricorn, I did try remain open-minded to see if any other specialties piqued my interest. My parents were like, we'd love you to be a general practitioner, a family doctor, because obviously you're most useful to your community in that realm because you're a generalist. But psychiatry just always struck a chord with me. And then I had my own personal experience of clinical depression halfway through medical school. And that was a really troubling and confronting time for me because it set off a lot of alarm bells in my world of how can I be a doctor that looks after other people's minds if I can't look after my own? Does it mean that I'm incompetent and I won't be able to do this role? But thankfully, I recovered from depression and the acute stages of it. I do still take medication and have other forms of therapy, but it did just further compound my absolute drive to further add value to the world of mental illness, and also to understanding how can we mass psychoeducate people on both mental health and mental illness. And that's when I became really passionate about content creation.
Wow, thank you for sharing vulnerably. I think that's so important today when we may think that doctors, clinicians, they have this appearance of like everything's all fine, they have everything together, they don't face any issues, right? And that's obviously not true. I think it's really important for everyone to hear that it's okay to admit that you're having trouble. It's okay to admit to having mental health challenges, just like physical health challenges, right? There's a lot of stigma around that. So I really appreciate you sharing. And that sounds like you're personally drawn to this from your experience and you want to help others. And that's really powerful. it brings to mind this phrase, which I think you've used, which is this wounded healer. And I know that you've said you've sort of recovered from some of the acute stages of depression. And so when you're sort of thinking about this in your experience, what does it mean to be a wounded healer in healthcare? How do you sort of make sure you're healed enough? Take sort of self-care. I can't imagine residency medical school is easy. I've heard a lot of stories. How do you sort of balance that, your own self-care, while you're still treating other people?
Yeah, I think it's a great question because, of course, it can lead to a bit of controversy and critique in this area, especially in the States. I know how rigid the legality of having a mental illness and being a physician is, which is something, thank goodness, we don't have as much in the UK. But I know that when you actually declare it, it can lead to a lot of alarm bells in the system. So there is obviously embedded systemic discrimination with occupational health and disclosing that. So I think it's a really important, subject to discuss. And I think to start off with, I always say to people who are in the healthcare profession and if they are struggling, it's their choice whether they publicize it or not, and it's their own individual journey. So for me, when I made it back to medical school and was in active recovery, I had the insight of I actually want my story to be part of a greater good kind of arc and be able to show that you can't be what you can't see and, put my story out there online, but that's not for everyone. So I just wanted to start off by saying there is absolutely no right or wrong with advocacy, and you can be a quiet advocate in your community, or you can just keep it to yourself if that's what's appropriate for you if you're struggling with your mental health as a clinician. So I guess the fine line is knowing what your limitations are, and also knowing that the clinical consultation is about your patient and it's not about yourself. So what I mean by that is, if you work in psychiatry, for instance, there is, sometimes a lot of counter transference with your patients. So they
Mm-hmm.
could have similar stories to you or to your loved ones. And it's up to you to really be able to create boundaries and be there for that individual, but still show up with compassion. And there is a difference between compassion and empathy. And I'll probably butcher the definitions a little bit, but my understanding is compassion is more of a it's almost more of like a detached empathy, that you can be there for that person without taking away their tragedies as your own, and being able to actually leave the hospital, leave the clinic and say, that's not my story. I feel greatly for that person in the moment, but I want to help them, and I'm not going to take that home with me as my own story. But at the same time, that's very hard to do because we're not robots, and there is such a thing as moral injury, which we talk about a lot in the UK, especially during COVID times, where the things going around you are just so tragic that, of course, it's going to have an impact on your own psyche.
Yeah.
But I think what's interesting in the States I saw that got trialed is something called safe disclosure. So there's a protocol and a process to disclose your own lived experience to your client or patient that is done in a therapeutic, cautious, and thoughtful manner, only in the right context and when it's appropriate. And I think that can be of great benefit. So I'm really passionate about child and adolescent psychiatry. I'm working in an inpatient unit at the moment. And I would say that if I felt it was appropriate and meaningful, and that young person, for instance, had stigma around taking medication and how that impacted their identity and whether that meant that they could go on to be a certain profession, it might be useful for me to insert, well, do I have your permission to share something about my own experience with illness? And if they say no, or they don't seem open to it, that's absolutely fine. There's no offense taken there. It's about their time and their therapeutic recovery. But if it is appropriate, I would say, well, just so you know, I'm a doctor, I'm a pretty successful person, and I can honestly say that being on medication has helped me, and I have learnt to overcome the self-stigma. And I really hope that, by me telling you this story, you can see that people in successful positions can take medication too, and it's not an either or, black or white, of you're a patient or you're um a professional. And
Hmm.
so I think there's a really big fine line. And I'd also say, how do you know if you're safe to work? Part of being a doctor, and I can only speak for doctors as I know what our code of ethics are, etc., but I'm sure it's pretty translatable to other healthcare professionals, is knowing your limitations and non-maleficence do no harm is so important. So if I know I'm too tired, or I'm too overwhelmed, or for whatever reason, cognitively, I'm not all there, I will take a beat. And I've done that when I'm on night shifts. And that's when I ask for help from a senior, or say, I've got to go eat my lunch now because I won't be able to think straight if I haven't
Hmm.
nourished myself. And that's that whole principle of putting your own oxygen mask on before helping others, and really demonstrating that self-care and patient care are two sides of the same coin. That if, as the clinician, you aren't looking out for yourself, it's very hard to give optimal patient care. So having that glass of water, because we know dehydration can really affect your cognition, will only help me be better to serve that patient. And taking those minutes to do so isn't going to necessarily always be life or death. Of course, there are always situations, I'm not a surgeon and I'm not an anesthesiologist or anything, where it could be a matter of seconds or whatever. I often do have the space in psychiatry to be able to take that beat. And I think it is utterly important. And especially because there is a role modeling piece of behaviors to patients as well that I think we really shouldn't overlook. And that's why I'm sure we'll discuss, I'm so big on nutrition and the hospital environment being a place of healing from food and beyond. And that if we aren't role modeling those behaviors in clinical institutions, then when people are discharged back into the community, then what do they know in terms of healthy behaviors? So a very long answer, but I think one must know their own limitations. And we also are trained in medical school to be able to pick up on colleagues in trouble, colleagues experiencing difficulties. So I remember in med school we had a scenario in what's called our OSCEs, which are like the clinical examinations where you have a patient actor and you're graded. And it would be like, for instance, your consultant, you can smell alcohol on their breath and they're about to operate. What do you do? And you go through a process, and it's all about
Right.
putting the patient first. So if I or a colleague are in any sort of difficulty, whether that's physical health, mental health, there are protocols in place to be able to really make sure that the patient isn't affected.
Wow. So much insight in that. I just want to repeat a little bit of some of your points. So I'm hearing this sort of take care of yourself and you can take care of others, right? It's okay to admit when you need help. It's okay to admit mental health struggles, physical health struggles, and to actually get help yourself. And there's this fine line between oversharing or over disclosing when it's not helpful or maybe counterproductive,
Hmm.
but making sure that, it's going to be helpful for the patient. So if somebody is in a situation where, wow, it would feel sort of validating to hear if my psychiatrist or doctor had was on medication or struggled with similar mental health things in a very professional sort of manner, that can be actually very healing for certain patients, right? So when it's appropriate to share. And also I really like how you share publicly. It's something you said you've chosen to do. I think that helps destigmatize this in the field itself. So among healthcare practitioners, especially probably doctors, who have to go through residencies with extreme working conditions and hours and seeing really, really hard things. So really appreciate that. You mentioned nutritional psychiatry, and let's get into that. I want to talk about the gut-brain axis and all sorts of things. So for listeners who haven't heard of nutritional psychiatry, What exactly is it, and how does it differ from traditional psychiatric treatment?
Yes, this is my absolute passion area, so I'm always delighted to introduce it to a new audience. And so for me, I got into the field of nutritional psychiatry actually quite early on in medical school, where I did a research project on the impact of diet on mental health. And I guess the reason why I did that is because I was just interested and I just followed. I'm someone who just follows their curiosity. And then I discovered that actually this is a field out there. And when I was doing it was probably around 2018, 2019. And this was actually just after the first randomized controlled trial in the nutritional psychiatry world by the absolute incredible Professor Felice Jacka and her team in Australia at the Food and Mood Centre. And it was called the SMILES trial. And it was the first time that they were able to show that a dietary intervention had the power to put depressive symptoms into remission compared to the control.
Wow.
And when I discovered that, I thought, wow, how are we not, we're missing a trick. How are we not utilizing this as a treatment target in the mainstream? Why is this on the fringes when we all eat and we all are vulnerable to mental health challenges and most commonly common mental health disorders such as depression and anxiety? Yet,
Hmm.
how little is food actually part of the conversation? And I started to really think about what the factors were as to why food wasn't being discussed as a mainstream. And then you start really uncovering the vested interests. And it's pretty similar with the reasons why food isn't discussed in as a therapeutic intervention in all other specialties, from cardiology to stroke medicine to women's health, geriatrics, pediatrics, etc. And in medical school in Western countries, so not even specific to the UK, big problem in the US and all other healthcare systems, you are taught a very reactive approach whereby it's a pill for every ill and let's deal with the symptoms. How can we treat them rather than getting to the crux of it and that root cause and talking about lifestyle factors and those upstream behavioral, lifestyle, and psychosocial factors that can lead to behaviors that then can lead to meeting the threshold for diagnoses later on. And when I realized that, I realized, wow, we're up against a lot because we've got big pharma, and I'm not anti-medication at all. I take a very balanced approach, but what I do advocate for is the judicious use of psychiatric medication. And if you're not in the acute throes of depression, insomnia, psychosis, and you are reaching out for help with, say, your primary care doctor, your family doctor as the first port of call, why can't we try exercise, nutrition, arts interventions, etc., something more holistic? And then if that doesn't work, then we can go up in the kind of treatment algorithm. Whereas practice is usually just very reactive, straight to the prescription pad. And again, what
Yeah.
are the other systemic issues that are leading to that? Lack of time, doctors are under pressure, and we are influenced by our teaching that we get in our academic programs. So if pharma reps are coming in all the time to give us teaching or talk about a new drug, that's going to be more in the consciousness rather than having dietitians, RDs coming in and giving us teaching, which is so few and far between. We really don't utilize them enough, and they are the unicorns of our healthcare team. So there are so many factors: lack of time, lack of knowledge, because it's not actually taught in medical school sufficiently, nutrition, which is why I started NutriTank, which is now a national organization that has led to really good policy change in the UK. And it was never the fault of doctors or blaming them for not knowing about nutrition to be able to impart that knowledge on patients. It was because they weren't taught about it in the first place due to the
Right.
systemic issues of training. So we have to go back. So the field of nutritional psychiatry for me, we are really getting there in terms of it becoming slightly more mainstream from the fringes, because after Felice's trial in Australia, there was another RCT that was done the Healthy Med trial that was essentially able to replicate all the findings and show, yes, again, Mediterranean diet is incredibly beneficial for depression. And since then, we've had other studies come out, and the field has really started to snowball with evidence and also real life interventions. And Australia are really leading the way for that. They've even got nutrition into the Australasia psychiatry guidelines for depression, and we don't have that in the UK, sadly, yet. It's not in our guidelines. And sadly, doctors are very driven by protocol and guidelines because, again, you are so pushed for time, it's so high pressured. You need to go to what is in front of you and not try, and you don't necessarily have the creativity and capacity to think out of the box.
I hope, Ali, that you maintain that passion and approach as you continue your career, because it's so needed. It's so refreshing to hear, as a training psychiatrist who is saying, look, it's not just medicine first. It's like diet, nutrition, lifestyle, social connection, all of that. Huge, right? And you're saying it's not just, the first line of defense to go to medicine. Of course, if you're in acute crisis, yes, there are times, right? But there's just there's so many times where it can be overlooked. And what you're talking about is getting to the root cause, not just treating symptoms, but really trying to understand what is the sustainable approach here that is going to have lasting change. So let's, can we talk about this connection between the gut and the brain? We have, we do know, you're talking about trials now that show the connection between diet and mental health, whether that's depression or other conditions. What is this gut-brain axis, and how does it manifest?
Absolutely. So the easiest way to think about it is from our own stories. And we all have experienced butterflies in our stomach and our stomachs becoming just knotted before we have, high performance event of some description. And that really is our gut and our brain communicating with each other, and really tangible examples of how they speak to each other. And more so, we know that if we're anxious, we either find it really hard to eat or we overeat. So we have so many behaviors when it comes to food and nutrition that are linked to our mental state. So the gut-brain axis is a bidirectional pathway between our gut and our brains, and how one impacts the other. So we know that people with inflammatory bowel disease like Crohn's and ulcerative colitis, they have a much higher risk of developing mental illness. And we know that it works for the opposite as well, that people with mental illness will have a lot of gut dysfunction and gut issues. So we need to really wake up and think, why are we siloing these specialties, gastroenterology and psychiatry? Why aren't they speaking to each other? And why aren't we all coming together and using food as that common place to not only work as a therapeutic intervention to help with restoring a symbiosis, as we call it, in our gut microbiome, whereby our good microbes are overpowering the bad microbe populations and taking you out of dysbiosis, which means an imbalance, and the bad ones overpowering the good ones. Why aren't we using that as a treatment target? But also, why aren't we using food as a method of communication, as a window into someone's culture, understanding, an outlet for joy, cooking as a way to de-stress? Because for me, I think we're also really quite up at the moment against big nutraceutical, even more so actually sometimes than big pharma, with people not making any sustainable, you asked about sustainable changes, any sustainable changes to their eating behaviors, and having the same mindset with pharma as now with supplements, as I'm going to get XYZ supplements and have this whole regime every day, but I'm still going to go have a McDonald's. And I think we need to really get to the human behavior changes, which are so much harder, so much less sexy, no quick fix, no overnight success. But that's what leads to sustainability and education. And then something becomes second nature, and it's actually less expensive. People are really spending a lot of money on supplements and nutraceuticals at the moment that they don't necessarily need. And they're not, I really like to stress this point. People think vitamins and supplements and nutraceuticals are benign, kind of neutral elements because you can buy them over the counter almost everywhere.
Right.
But too much of them can absolutely lead to health consequences. So they aren't benign, and they do need to be handled with care and with a dietitian or doctor that knows what they're talking about and can give you the right doses, and only if it's clinically indicated from blood tests, etc. So I think, we need to really be bringing food back to the center of the discussion when it comes to the gut-brain axis, and also realizing that even gastroenterologists now are learning more about the psychological, or have already learned so much about the psychological influence of their patients' bowel diseases. And I think that's very exciting that we have really strong evidence for something like irritable bowel syndrome, IBS, that something like stress management through mindfulness, meditation, whatever it is now an incredibly powerful treatment alongside specific food diets created by dietitians. And it shows you that you need that holistic approach of mind and body being connected with your treatment goals and not separating them.
Yeah. Yeah. I mean, it's really clear that diet, nutrition is relevant for all mental health and quality of life and well-being. And it also is clear that there's this feedback loop where diet and nutrition influences mental health, and mental health can influence nutrition. Very generally, we know diet and what we eat affects our mental health. Can you mention or describe specific mental health conditions where certain nutrition interventions can have an impact?
Absolutely. So I like to think about things in a simple way so anyone listening to this can understand. And I often like to talk about the triple F. And for me, that is fermented foods, fiber, and fish. So we know to promote strong brain health, omega-3s, which are found in fish and seafood, really, really high concentrations are found in biconclaves. So if you like mussels, clams, anything that has the biconclave, like two.
Bivalves. Yeah.
That's the
And
word. Sorry,
and
where
they're
did I
also very nutrient dense. So it's not just the
bivalvular?
omega-3. Yeah.
Exactly. I thank you for, I don't know where that word conclave came in my mind. But thank you, bivalvular. And so I, often will talk about that and how strong the evidence is for brain health from that perspective. But also, it's important to obviously consider inclusivity, and not everyone can have fish and seafood due to allergies, due to their religion, or due to just preference and taste, or due to dietary preference like veganism and plant-based. So it's important to say that, of course, people can supplement with omega-3, usually best from algae bases. And of course, this is going to vary as well. So really important to find the right omega-3 supplement. And then there's really strong data to show that fiber is one of the most important things for our gut microbiome, and that increasing your fiber can have a huge impact on mental health as well. And also fermented food, Professor Ted Dinan up in Ireland at APC has done some brilliant research showing the power of fermented foods on our gut microbiome and how that translates to better mental health and brain health outcomes. Of course, there are so many more really important nutrients, but I quite like to keep it simple, and there is still a lot that we don't know. So Ted Dinan and his group, John Cryan at APC in Ireland, they've been looking at probiotics for many years and have written a wonderful book called The Psychobiotic Revolution. So looking at how probiotics can impact our brain and mental health, but we're still not at the stage yet to be able to say which is the exact perfect formulation for mental health. There are, quite a lot of studies that they've recently produced getting us closer and closer, and products on the market. But I think from my perspective, I'm a food first approach. And if we can get probiotics through food, as we've discussed, fermented food is a wonderful option. And something as simple as, the humble yogurt is really powerful. And they actually showed that yogurt has higher probiotic quality than a lot of kefirs on the market. Not to say that I drink a kefir every day. I absolutely love it. They've been drinking it in Eastern European and their own version in the Middle East and India for many years. So I think there's a lot of food first options that we can get probiotics from.
So I love that 3 Fs: fermented foods, fiber, and fish. It's
Yeah.
easy to remember. I don't think I'll forget that one. So that's also for general health, I'm hearing. And you've mentioned depression. Your approach is a bit more generalized to making sure people are considering nutrition in their holistic health and well-being.
Absolutely.
You mentioned founding NutriTank, which
Yeah.
I really admire, because we talk a lot about how little education in nutrition medical doctors receive and how that's not a big part of coursework. Can you tell us some information about that? Does that vary depending on where you get your medical degree from?
Absolutely. So I can speak to the UK and a little bit on the US. So when I went to medical school, which was in 2015, I had already discovered this interest that I had in nutrition. So when I went, I thought I genuinely would be learning about it and it would be part of treatment protocol, because I think it's so important that we discuss that nutrition absolutely can be first line, um, before we jump to medication, but it can also be complementary alongside medication. And we actually have studies to show that when you improve your gut health, which consequently improves your gut microbiome, then that can lead to greater efficacy of medication. So we need to think about that drug nutrient interaction as well, and not silo off things and be too much in one camp, which I do see a lot of kind of social media content creators tend to stay with one modality rather than kind of bridging them all together. And so when I was at medical school, I was really surprised that nutrition wasn't being spoken about, and shocked because our NICE guidelines, which is the National Institute of Care and Excellence, which informs all UK doctors' treatment guidelines, the first line management of every chronic condition, from polycystic ovarian syndrome and women's health to heart disease and cardiology, is off a patient's diet and lifestyle. And then you jump to the next part in the treatment algorithm, medication, and then in some cases surgical intervention, etc. And so it was written in the guidelines, but we just weren't being taught about it. I wasn't seeing it role modeled with doctors that I was shadowing on the wards in my clinical placements. And so I started digging deeper and realized that the reason why it's not taught, the reason why it's not practice is because it's not taught. And then I met my co-founder of NutriTank, Dr. Ian Broadley, who was a med student with me at the same medical school, Bristol, and we said, let's do something about this. Let's create a movement where we actually can disrupt the system and get it taught so that it becomes part of the doctor's toolbox. When you're reaching for your prescription pad, you can also talk about diet and lifestyle. And so it was, a bit of an uphill battle, a lot of inertia, a lot of challenging old-fashioned beliefs around the role of the doctor, being more drawn to kind of the sexier side of things like medication and surgery. And, talking about diet isn't necessarily everyone's bag. And that can be a reflection of their interests or their own lifestyle. So it's quite complex. But we realized that when we looked at the Lancet study, that poor diet is the leading cause of death and mortality worldwide. So it's actually irresponsible for medical schools to not factor that into doctors' education, because we can't just rely on RDs, as amazing as they are. There are not enough of them. Not every service will have one, especially in the UK when we're a socialist national healthcare service where there are cuts all the time. There's not always a dietitian that you can access. So the responsible thing is to have your primary care doctor and all clinicians that you see in your illness journey informed in diet, maybe not in a specialist knowledge way, but informed enough from a gatekeeping perspective that you start that patient or client on the right trajectory to restoring health using diet, and then signposting them to maybe more specialist services, referring them to a dietitian. But not everyone needs a referral to a dietitian. So we really wanted to shake things up. We created NutriTank in 2017, and it's gone on to be a triple award winning community interest company. We've informed policy change by getting a clause added to our NHS long-term plan in 2019 with a greater commitment of nutrition to frontline healthcare professionals. We've worked with the British celebrity chef Jamie Oliver, who has really big reach with public health and food advocacy here in the UK. So that got us through the door to Department of Health to do work with them. And then that led to creating a gold standard document with the General Medical Council, which is who regulates doctors in the UK, to create a guide with the Association for Nutrition, which is the regulatory body for nutritionists in the UK, on what nutrition in medical curricula looks like. And that was a really important piece of work. But then, a barrier that has come up is implementation, which is what happens all the time, is that when you have autonomous organizations like medical school, where there are different sets of expertise, different priorities, some medical schools are more research focused, some medical schools have more faculty in a certain specialty. So that's, sometimes what will get prioritized. And so it's up to the medical school as an autonomous institution to choose still what they take from this gold standard medical nutrition curricula that we all created. And that can be an issue, because how do we incentivize medical schools to put pressure on them to say, no, you need to actually put this in the curriculum? And so that's where we thought we need to have a bottom-up approach as well as a top-down approach. And we created our NutriTank medical school communities, where nearly every medical school in the country will have a NutriTank society, in the same way that at med school you can be part of the orthopedic society or the pediatric society and learn from a continued professional development perspective by attending events there. And so we created NutriTank society so med students can be enthused and inspired by the field of nutrition and lifestyle medicine to not only help their future patients, but also help their own self-care. And we've moved a bit away now from undergraduate stuff, because we're no longer med students, but we still have that presence in med schools. And we're now trying to get as much nutrition education into postgraduate training in all the specialties, and actually into the training within the NHS and hospital training. So a big milestone for us in October 2024, so last year, was we achieved our first contract with an NHS trust in Cornwall. So it was a commercial contract whereby we created a lifestyle psychiatry course for 500 of their mental health team members. And it meant that they were able to learn about the importance of social connection, nature and mental health, movement and mental health, nutrition and mental health, sleep and mental health. And we had modules on each of those. And it was a really big moment for us to say, okay, we can get this into the mainstream. It's just a bit of a slow process. And if one institution starts doing it, hopefully there'll be a ripple effect, and we can incentivize other institutions through our advocates who are part of our community on the ground, say, hey, can we get a bit more of this type of training, and kind of get into that consumer disruptive model. So in the States, I know that it's a similar uphill battle, but I want to shout out to Lane Medical School, who are just sublime in New Orleans. I actually went to visit when I was a medical student. They started culinary medicine, which is the wonderful practice of teaching healthcare professionals and healthcare students about nutrition, but through culinary skills. So cooking the recipes, actually learning how to handle food and how to cook, and then how to talk about those recipes and those ingredients with your patients dependent on their case profile. And you learn about this through amazing case studies. Bob is 55, he's a truck driver, has a sedentary lifestyle. These are his bloods, his cholesterol is up, and his blood pressure's up, blah blah blah. He's basically got, cardiometabolic syndrome. How can you intervene through diet and through a culinary practice? And I went to their teaching kitchens in New Orleans. They have the most incredible center, and I was just like, oh my goodness, you guys know what you're doing. And so I know that culinary medicine in the States has actually had a bit of a ripple effect as well, but again, it's not in every medical school.
Amazing. I am so happy to hear of NutriTank. We need a lot more of that approach. The top down and bottom up, like you said, I think is addressing it from angles, and we have to be patient before transformation occurs, but it's happening little by little, I hear. I also like that you mentioned it's not food or medication. It can be both. And I think some people fall too far into one of those camps where it's like, it's all just about diet and lifestyle. Don't take anything that comes from a pill. And others who, maybe more in the conventional medicine approach, it may be a little bit too much of let's just give you a pill or prescribe something, and we don't get to the underlying cause. You really try to take this balanced approach where you say, look, diet, lifestyle, relationships, community, arts, all of that is really critical. And there are times where, it's really important to have medication, and that's okay, right?
1000%. The messy middle is where I belong, but it doesn't make
like
me
that.
viral. So,
Messy middle. Yes, let's make that viral. Okay. And I think another area of your passion, that you have talked about is sort of youth mental health and creative arts. So you're a trustee of the Chimo Trust. Am I saying that correctly?
Yeah.
So that focuses on youth mental health through arts, physical activity, and then you say social prescription, which I'm curious to hear what that is. So why are these particularly important for young people?
Absolutely. So I can't speak for the States, but in the UK, we've seen a huge closure of third spaces. So third spaces are environments that kids hang out in. Well, it applies to adults as well, but I'm talking about it from the young people's perspective. So things like youth centres, sports clubs, boxing clubs, that kind of space outside of school, outside of those kind of mandatory institutions where young people can form relationships, create new skills, and meet new people. And when we don't have that therapeutic environment, we are left with young people not really having a place. And obviously, there's been a huge rise in social media. And again, I take a very nuanced approach. I think we demonize social media far too much with our young people and don't give them enough credit. And yes, there is harmful comment. Yes, there's a rise of cyberbullying. I'm never not going to say that that is destructive, but there are also such wonderful benefits of psychoeducation, really useful content on there to do with mental health and belonging, groups that they can find if they feel disenfranchised in their community, and people that they can meet online in a safe way. And charities and other healthcare professionals are on there giving really good resources. So I think, yes, we are seeing a rise in online communities, but we need to remember how important physical spaces are as well. So along with that, how important non kind of clinical activities are to a young person's healing journey, whether they are in recovery or even as a preventative measure. So at Chimo, we fund charities that have these holistic, non-conventional therapeutic approaches to youth mental health challenges. So we have a portfolio of around 15 charities here in the UK. We try and spread them regionally so that we aren't creating inequality. So we fund charities that have non-contact boxing, surf therapy, nature therapy, theatre and the arts therapy, even comics, and zine making, like kind of narrative medicine interventions, and horse therapy, which is like equine therapy, really exciting, especially for young people who are autistic and find that animal behavior and being around animals is a really crucial way for them to understand themselves. So we took this approach because we're seeing a rise of loneliness in young people, and actually there's a huge issue with that because for so long older adults have been thought as the lonely population. When you retire and you start being able to stop being able to do as much, of course there is that stereotype, and it is a huge problem of older adults being lonely. But we are now seeing that um younger people, so children and adolescents, are becoming one of the biggest groups for loneliness in a really hyper connected world that we're living in. So we need to evaluate why that is and how we can give them spaces to foster those connections. And so charities we fund have incredible communities that they have created. One of my favorites is one called Poetic Unity, which is a spoken word charity that helps young people from Black and Brown communities who feel disenfranchised in society. They help them, teach them how to tell their story through spoken word and meet like-minded people. So you can't be what you can't see, and have that role modeling. So I'm so big on that social connection, but also holistic therapies, because a lot of these young people have been in traditional child and adolescent psychiatry spaces and have found, for instance, talking therapy way too intense, where it's one-to-one in a clinical kind of sterile room with a practitioner who's very well meaning. They've found that ineffective, and will find being out in nature and having that, we know how much evidence there is for green space to be able to reduce stress, and being in green space has been able to help them reach those really vulnerable moments to share with the practitioner.
Okay. I'm very interested in this. I think you're highlighting some really interesting points. So, first, on this social media, you're saying there are a lot of risks and potential harms of social media for youth. And at the same time, there are actually really positive aspects in terms of, psychoeducation, finding connection in some ways for people who may be disconnected or disenfranchised. So it's sort of a double-edged sword. And there are, maybe there's a way to sort of ensure that it can be used safely for the positives. And I'm hearing also that in-person connection is so important. With increased technology, this could be one of these sort of unintended consequences where we don't have as much of these in-person things. So you're looking at youth and adolescent health and well-being from a holistic perspective of the actually built environment,
Yes.
animals, relationships, activities.
And I guess I didn't define what social prescription is, and it's one thing that the UK are ahead of the States in, which is right, something I'm proud of to be a part of. So, social prescription is essentially a medicalized term whereby healthcare professionals, primarily in primary care, so with your family doctor, are able to prescribe a social intervention to a patient. So if they come in with social isolation, or for instance, even something like they have just been diagnosed with pre-diabetes, and referral to a community cooking group could be of use to them therapeutically, you as the clinician are able to formally prescribe them with a relationship that you have with your practice and the community. And so that has been termed social prescription, and it's now actually come to the States. Julia Hott is an amazing Canadian individual who has done a lot of work in the States getting it there, and she's written a brilliant book that I can't remember the name of, but I really recommend it. She's a journalist and thought leader talking about social prescription.
Awesome. I think I've heard, prescription of food as medicine in the US, sort of, prescribing fruits and vegetables. It sounds like a similar approach of prescribing social activities and connection. That's awesome. So last point I would want to sort of ask you about, if you have anything to say for youth and young people who are struggling with mental health right now, say they listen to this or somebody knows someone struggling with that, what would you say to them? How would you provide some guidance for them?
So I'd start off by validating them, saying that it is okay to not be okay, and you are absolutely not alone, and it doesn't make you any lesser than as a person, and it doesn't form your identity. It's just a small part of your identity and where you're at in that moment in time, and that there is always hope. And I'm so passionate about youth mental health because we can early intervene and set people up to thrive in life. And there are just so many examples that I could give of brilliant young people who have really struggled in preteen or in their adolescence, who have gone on to be great successes and advocates for their community. So I really hope that young people, if they are listening out there, or parents of young people, know that it really isn't a life sentence if you do struggle with an eating disorder, or you struggle with OCD or depression, and that there is help out there, and help in a way that can be individualized to you. So don't give up if, for instance, you try regular talking therapy with a psychologist and it isn't effective for you, because there is no one size fits all, and you can find other therapeutic interventions like what we've discussed with these holistic interventions that can be suited to you in your recovery.
Awesome. I hope that is useful to youth and others who are obviously, all of us know youth, and mental health is something that is a challenge I think a lot of us face throughout our lives. Do you have any ideas for how can we start to change the food that is served in hospitals and that is used in hospitals and in therapy settings?
Absolutely. So I guess I start off by explaining why I think we've got to this situation. And in the UK, hospital food is viewed as part of hospitality, and that offering of a hospital as a business, serving a consumer, rather than being part of the therapeutic approach. And so that leads to a really big separation of the role of food, because the hospital food is contracted through procurement of things like the cleaners, the porters, etc. And it's outsourced to these big facility management companies where their in-house dietitians have nothing to do with our inpatient dietitians, for instance. So it's really tricky to be able to create change when you have these big contracts, and it becomes quite political and commercial and commercially vested. So in the East, like places like Singapore, they have been having menus for their patients on different wards with different therapeutic intentions for a really long time. It's part of their ethos. And I think we need to have this huge paradigm shift in, most of what we've discussed already, whereby we are viewing food as part of a treatment protocol, as part of the care that we provide, and not just a hospitality add-on. Like, yeah, there's a kind of shop within the hospital, you can go get some snacks and crisps and things. No, what can we actually provide for the relatives and the families and the staff as well of the patients under that healing institution kind of umbrella? So I'm really big on staff well-being through hospital food as well. And I think there are some amazing projects that can be done, but unfortunately, everything I've seen so far has been on a small scale, and we need to be able to really scale up things like quality improvement projects. And I did a project on a psychiatric male ward a few years back, where I, for 6 weeks, ran a nutritional psychiatry cooking program, and it was me by myself in the kitchen cooking for the patients, because from a risk assessment they weren't really allowed in the kitchen with me because I had knives, etc. But
Hmm.
I made food based on different themes each week using the Mediterranean diet principles, whereby they could be interactive with it. So I'd get them to smell the herbs, and then if we were doing smoothie bowls, they could assemble it themselves. So I gave them choice and agency whilst preparing it. And what was so amazing about that project, it goes back to how we can't just rely on nutraceuticals because food is so much more than its nutrients, is that as staff and patients, we ate as a team with the food that I created, and it really broke down those barriers. And the consultant said to me, wow, Ali, you've really made my job easier because the patients don't hate me as much because they're so used to seeing me in ward round where I tell them that they're going to be here for longer, or that we need to try another medication, or their leave isn't being approved to leave the ward. And this allowed us to just interact from human to human. And it was really wonderful to see the people who really were quite against healthy eating change their mind. And one of the male patients said to me, Doc, you've got me to go from KFC to kimchi. And I was like, oh my gosh, that's like the biggest reward I could ever have, is to change someone's mindset in that sense. And what was really amazing is I actually was able to have two of the men in the kitchen with me when they got to a really stable place with their mental health and were about to be discharged. And we made fresh pasta together and did the chopping and things like that together, which was a really wonderful therapeutic relationship. So I do think these projects can exist. We just need a lot more resources and manpower for them.
That's amazing, Ali. So cool to hear. You're an inspiring person because you don't just sit there and let things happen when you see sort of problems in the system, injustices. You go out there and you start new companies and you do trials and you make a difference. I really admire that. So thank you so much for taking the time to speak with me. And I know that people will really enjoy our conversation.
Thank you so much for having me, Ty, for your deep listening. And yeah, I really enjoyed your insights too.